Welcome to Friday's edition of COVID-19. There has been a tangible drop in daily tally here in Korea today. And come tomorrow, we mark a full year since the start of Wuhan's 2.5-month lockdown, speak of which we are poised to connect to that Chinese city in a bit. But first, here is our ChunU with the pandemic updates. So local authorities have recorded a fresh fall in numbers today.
Right, Sunny. Korea posted its lowest number of daily infections in around 2 months, which means we are back to the 300s this Friday, just like earlier this week. And 346 cases, to be exact, have been posted, which brings the total here to 74,262. The death toll at 1,328. And out of the 11,519 people currently under treatment or in quarantine, the number of patients in serious or critical conditions stands at 299. And for the first time in 25 days, this number has dropped to below 300. And domestic transmissions this Friday have dropped to the low 300s, while imported cases are in the low 30s. If we take a look at the recent developments, last Friday we had 512 infections and similar cases in the 500s over the weekend, after which we dropped to the 300s, had a slight rise to the 400s, and now we are below the mid 300s. So let's hope that this trend will continue. Now, the government does say that it is viewing this as a clear downward trend, but officials are warning that the citizens should not lose vigilance. So let's take a listen.
It is a positive development that caseloads have been steadily falling as of late, thanks to the active participation and cooperation of our citizens. But when considering the slow rate of decrease, asymptomatic cases, and variants from abroad, we are not in a safe situation.
And authorities especially call on the public to cancel weekend meetings, as there has been observed a rise in movement across the nation during latest weekends. And that especially as we are still seeing infections scattered across the nation despite the overall drop. Speaking of a drop, the Gyeonggi province had similar cases to Seoul, so there has been a significant drop in cases in this province.
I see. So meanwhile, on the international front, I hear some places that is, in neighboring China are back on emergency mode.
Right, Sunny. China is on high alert, especially with the Lunar New Year travel rush approaching and new cases emerging in the country's largest cities. In Shanghai recently this week, the first local transmission has been posted for the first time in 2 months, and also a partial lockdown is in effect in the capital, Beijing. And now in Tokyo, meanwhile, where daily cases have been hovering above 1,000 for 9 straight days. As of Thursday, that is, reports are emerging over a possible cancellation of the Tokyo Summer Olympics, while the IOC's head Thomas Bach stated on Thursday that the Summer Games will be held safe and successfully with no plan B. And now, meanwhile, over in the U.S., President Joe Biden had a busy first full day in office, signing some 10 COVID-19 related executive orders, which now means more vaccinations, more testings for the virus, and also the commitment to stay with the World Health Organization, also joining the COVAX facility. And now let's take a look at the numbers, and starting with the U.S. here at 25.1 million infections, has recently also recorded the second highest daily death toll of over 4,300 fatalities. And then we see here Spain with resurgences at 2.5 million, having surpassed the total number of cases in Italy. And we have Germany at 2.1 million, which has decided to extend its lockdown until February 14th. And the global tally now stands at 98 million. And if we do see daily infections at this level, around 780,000, we might have over 100 million cases by early next week. And those are the updates I have for now. Stay safe over the weekend, and I'll be back on Monday. Back to you, Sunny.
All right, Soa, thank you. Right, on the vaccine front, Korean vaccine makers are noting some progress, while new findings show Pfizer's dose protects against the variant that was first detected over in the UK. Now, for more on these updates, I have our Kim Sang-hyun here in the studio. Welcome, Song-yeon.
Good afternoon, Sunny.
Right, let's begin with the latest prospects on homegrown vaccines, Song-yeon.
Yes, Sunny, several local vaccines are currently under development here in Korea. In fact, the Korean Ministry of Food and Drug Safety said it has approved 7 local COVID-19 vaccines for clinical trials. Now, one of these, a vaccine called Gov'T, developed by local firm U Biologics, got the green light yesterday from Korea's drug regulator. The vaccine is now clear to proceed with phase 1 and 2 clinical trials aimed at evaluating its safety and immunogenicity in healthy adults. Gov'T is a recombinant vaccine based on surface antigen proteins from the COVID-19 virus. Now, these proteins form neutralizing antibodies by stimulating immune cells. Meanwhile, as we all heard on Wednesday, SK Bioscience will produce Novavax vaccines locally through a technology transfer from the U.S. pharmaceutical company. The deal is also expected to help SK Bioscience accelerate the development of its own COVID-19 vaccine. The firm recently started clinical trials for MBP 2001, which is an in-house COVID-19 vaccine candidate. And Novavax's technology transfer combined with SK Bioscience's own platform technology is expected to make the Korean company a strong global player in COVID-19 vaccines. Now, regarding the Novavax vaccine, a local medical expert noted that it could be a game changer.
It's a promising vaccine that can generate antibodies very effectively and create cellular immunity. So I think it's one of those candidates that can be a game changer.
The biggest advantage of the Novavax vaccine is that it can be stored for 1 to 3 years, much longer than other vaccines, which must be used within 6 months. As a result, vaccines produced this year could still be administered next year.
Well, that's good to know. Now, Song-yeon, as I mentioned earlier, Pfizer's vaccine also offers protection against the UK variant.
Right, that seems to be the case according to the results of an independent lab trial over in the U.S. Now, Pfizer and BioNTech built this case that their COVID-19 vaccine will protect against the new variant from Britain. Now, backing up a study released by the University of Texas Medical Branch earlier this month, the latest test results from company scientists released on Wednesday showed that antibodies in the blood of people who had been given a Pfizer-BioNTech shot were able to neutralize a version of the mutant virus that was created in the lab. Now, unlike the earlier study, which focused on just one crucial mutation, the new research tested all 10 mutations in the virus's spike protein. The results are promising, but inconclusive, as scientists continue to monitor whether emerging mutations in the virus may require vaccine modifications. Now, in a concerning development, scientists found in another study that half of the blood samples collected from COVID-19 patients did not contain the antibodies needed to protect against the South African variant. The Korean government announced yesterday that it will conduct related studies of their own on these new COVID-19 variants as well.
Right. Meanwhile, Song-yeon, I hear there's also been some fresh concerns over vaccine side effects.
That's right, Sunny. If we go over to the United States first, healthcare officials in California have told medical providers across the state not to administer doses from one lot of Moderna's coronavirus vaccine. Now, this comes amid an investigation into possible allergic reactions reported last week in a number of people who got shots at a community vaccination clinic. Moderna said 37 different states got shipments from the lot, which included more than 1.2 million doses, and said most had likely been used. In California, more than 330,000 doses from the lot were distributed to nearly 300 providers across the state from January 5th to the 12th. The California Department of Public Health said fewer than 10 people at a clinic in San Diego who received the shots from this lot required medical attention over the span of 24 hours. And the state said it was not aware of anyone elsewhere who had similar allergic reactions after receiving the vaccine from this lot. Let's take a listen to what a Korean expert had to say regarding this matter.
They need to check if a specific component of that particular batch of vaccines perhaps contain more substances that could spark allergic reactions, or if there was a quality control issue.
California's health department said it recommended pausing the entire lot, but experts have noted that there are no immediate replacement doses in addition to what had already been ordered. A top U.S. vaccine expert also said California's decision to hold back the doses carries its own risks, especially since allergic reactions can be monitored and treated, and in this case, they occurred at only one location. Now, meanwhile, health authorities in Norway announced they found no evidence of a direct link between the Pfizer-BioNTech vaccine and the elderly deaths reported last week. But such developments are triggering anxiety throughout the world about the potential side effects of COVID-19 vaccines.
Right, understandably. All right, Song-Yeon, thank you very much for that. Hope to see you again next week.
Thank you.
On December 31st, 2019, China informed the global health body of cases of viral pneumonia in the city of Wuhan. Now, it's been a little more than a year since then, and for a glimpse of the situation there now, I have the Korean Consul General in Wuhan, Kang Seung-seok, on the line. Welcome to the program.
Hi.
I believe a research team from the WHO is in Wuhan right now to probe the pandemic's origins. What can you tell us about the atmosphere in the city there right now?
On January 23rd last year, the Chinese government enforced strong and efficient containment measures to stop the spread of COVID-19. And all means of transportation leaving Wuhan were stopped and canceled. Due to such strong measures, Wuhan was released from lockdown 2 months late on April 8th. Since then, people have mostly returned to their everyday lives with notable differences that they wear face masks as part of their daily routine. There have been 0 cases of COVID-19 infections in Wuhan for the past 10 months. And the Chinese people claim that Wuhan is now the safest city in the world. Tomorrow will mark the 1-year anniversary of the lockdown of Wuhan. However, because of recent outbreaks elsewhere in China, the public atmosphere surrounding this anniversary has been quiet and subdued.
How are Korean nationals in Wuhan faring?
When the outbreak of COVID-19 was most severe here in Wuhan, almost all of the Korean citizens were evacuated to Korea. Only about 100 people choose to stay here. Since then, around 300 people who evacuated have come back and have returned to their occupations or schools. Because they have left Wuhan for almost 6 months, many self-owned businesses have closed and much more have suffered losses. However, as the economy of Wuhan is picking up pace, Korean businesses are also slowly recovering. To support Korean businesses in this time of difficulty, our Consul General has been providing assistance in various ways, such as by negotiating with the Chinese government, providing legal consultations, and providing businesses to businesses networking opportunities.
Now, as you mentioned, at the height of the situation in Wuhan, the government here chartered several flights to evacuate Korean nationals from the city. I understand embassy and consulate officials there played a key role in making the essential arrangements. Please tell us more.
When Wuhan was locked down due to the pandemic, the unprecedented situation caused a lot of worry and panic among the Korean citizens. However, I was very impressed with how they showed solidarity and the spirit of self-sacrifice at such a difficult time. Our Consulate General worked with the Korean citizens and with the Korean embassy in Beijing to evacuate our citizens safely to Korea by arranging chartered flights, providing medical equipment, and negotiating with the Chinese government. the Korean Community Association here in Wuhan played a central role, and many volunteers worked with our consulate staff to provide essential services, such as providing transportation to the airport and distributing food and medical equipment. Although it was very difficult experience, it was also very worthwhile.
Right. You mentioned sacrifice and service. Now, you yourself arrived in Wuhan on February 20th last year, I believe, on board a cargo plane that also carried masks and other relief supplies. Essentially, you began your duties at a time of emergency in Wuhan, and I hear officials there made note of Korea's support through your dedication. What are your thoughts?
The Korean government decided to send the Consul General to Wuhan at the most appropriate time. And I merely followed the decision as a civil servant, as a diplomat. On February 20th last year, I arrived in Wuhan by taking a cargo airplane that contained masks and medical equipment. At the time, there were around 100 Korean citizens in Wuhan who had decided to stay, and my foremost duty was to protect and assist these Korean citizens by appointing a consul general at an appropriate time. I believe that the Korean government was able to send a positive message to China that we are a country that helps our friends in a time of need. The experience of Korea assisting China and vice versa during the COVID-19 pandemic will be a huge diplomatic asset to further strengthen our relations in the years to come.
Right. One final question then. What is the latest with regard to the vaccination campaign in China?
The Chinese government has selected certain occupations to be vaccinated, such as people working in the fields of medicine, airports, cargo transportation, and quarantine facilities, and has already started the vaccination process. Regarding vaccination for non-Chinese citizens, so far there are no plans from the Chinese government, and we are monitoring the situation closely.
I see. All right, Consul General Kang Seung-seok, thank you very much for making the time to join us live with your thoughts.
Thanks so much.
Right, here on the local front, a research team has developed an affordable and promptly available clinic module in response to the lack of negative pressure wards. Our Chun Song-cho is on site right now. Hello, Song-cho.
Good afternoon, Sunny.
Now, Song-cho, do start us off and do show us what that module looks like.
Yes, so I'm at the Korea Institute of Radiological Medical Sciences here in Noang-gu District, northeastern Seoul. And what you see behind me is what's called a mobile clinic module, or MCM. It's an inflatable isolation ward that's been designed by researchers here and a team led by Professor Nam Taek-jin at KAIST University. So this module uses negative air pressure, which is crucial for isolating and treating patients with infectious diseases like COVID-19. So without further ado, let's step in and take a look inside. So I think you can see from here that this module, or this tent, is pretty big. It's about 450 cubic meters big, about the size of a basketball court. And since it's like a giant float, it's adjustable, expandable, movable, and more than anything, it's extremely easy to set up the entire thing. So if you have the right equipment, such as door frames or multifunctional panels and lighting, then you can assemble the entire thing on the spot, and it doesn't even take a day to build up the entire thing. So it can reduce the installation cost as much as 80%, and that's quite incredible. So the way how you step inside is the switch is below here so that you don't have to touch anything like the doorknobs. And these are the workstation with all the computers and printers set. And this is the nurse station. As you see all these equipment around me. And then if you follow me here, you see all the corridor. This will lead to other rooms like locker room and the 4 patient rooms. But before I mention that, I want to bring your attention to here, which is the machine for the negative air pressure system. The whole point of having rooms at negative pressure is to prevent any airborne infectious viruses like COVID-19 from escaping the ward and contaminating and infecting other people outside. So this machine will pull the air from outside into the rooms and then filter the air before letting it outside. So no contaminated air flowing outside of the tent. So you see negative pressure room number 1, 2, 3, 4. I'm going to step in right here to show you what it looks like inside the patient room. So again, you use this switch pedal to open the door. So here it is. You see all this comfortable bed and a bathroom so that patients can stay inside for days and weeks at a time. And this one is a ventilator, so that means each room is equipped with ventilators, and the rooms can be instantly turned into ICU rooms, depending on how severe the outbreak in the country is. And don't be surprised, this is not a real person. This module is still under 3-week test period, so we don't have any real patients inside. It's just a mannequin. And this is the glove box, and that's the pass box, which they use to pass around objects, equipment, and products in and outside of the room without contaminating anything. All right, so like I said, this module is still under the 3-week test period. But considering its convenience and efficiency, it will be commercialized pretty soon. And this will be really, really helpful to meet the high demand of the negative pressure rooms inside the country. So now it's time to invite Dr. Jo Min-soo, one of the officials here at the Radiological Medical Sciences, so that I can ask him some questions. Good afternoon.
Good afternoon.
All right, so I think our viewers would like to hear from you how this module ensures safety and convenience not only for patients but also medical workers during treatment.
Yeah, there is an optimal system established to maintain negative air pressure. It can reduce fatigue of medical staff by using glove and pass boxes. Incentive care can also be provided by operating in conjunction with the hospital system. Habitability is also secured to respond to various weather conditions.
All right, thank you so much for your answer. Thank you. Thank you for your time. Wow, so it sounds to me that this will provide another opportunity for the so-called K-quarantine, or the Korean way of disease control and prevention, to be praised by other countries and to be used worldwide. This has been Chun Sung-cho reporting live from Nohon-gu, and back to Sunny in the studio.
Right, Sung-cho, and might I add, it's encouraging to know that such efforts continue to better tackle the pandemic here in the country. Thank you for that coverage.
대규모 검사를 통해 환자를 찾아내고 신속한 역학조사를 통해 접촉자를 격리하며 적시에 적절한 치료를 제공하는 것이 그간 우리의 주요 대응 전략이었습니다.
코로나19로 올해는 백신과 치료제로 대응할 수 있게끔 장기 전략을 잘 마련하는 게 가장 큰 그런 과제인 상황입니다.
Today, we take a look at Korea's ongoing battle against COVID-19 as part of our coverage of the one-year mark of the pandemic. Now, for more on this, I have Professor Chung Sun-jae from Yonsei University. Good to have you with us, Professor Chung, again.
Thank you for having me again.
And I also have Andrew Salmon from Asia Times. Good to see you again, Andrew.
Hello, hey, how are you?
Right, Professor Chung, speaking within your capacity as a doctor as well, what is your assessment of Korea's COVID-19 response over the past 12 months?
Yes, the 12 months, well, 1 year. We had many difficulties, as you know, and we had like 3 great peaks. And there was a problem maybe about the capacity of the receiving COVID-19 patients in the treatment centers, and also some serious cases in this more like ICU and more the severe cases treatment centers too. And people, they had to adapt to this unprecedented stage of the social distancing, and there was issues such as related with the mandatory masking, and well, there were a lot of difficulties. However, I think when comparing ourselves to other global countries, it seems that our response was fair or relatively successful. And it was also mentioned in many countries too. And it can be attributed to citizens' effort toward the quarantine system, and along with a thorough effort from the public sector.
Right. Meanwhile, Andrew, you've been covering the pandemic here in Korea for quite a while, including its effects and related efforts to contain it. What perhaps has impressed you the most?
I mean, I think what impressed me the most was from the very, very outset, from day one. You know, bear in mind, this was the second country to suffer a COVID infection after China. China had responded using a very, very authoritarian methodology to suppress it. Successful, but authoritarian. Korea, which had no other model to follow, decided we're not going to do that. We're going to follow democratic, open principles of governance. And they decided we're not going to lock down. We're not going to lock down the healthy. And I think that was a standout policy that enabled Korea and Koreans to maintain their social democratic freedoms of movement, of commerce, and of social activity. And I think that's a superb model. And I'm shocked and astonished that so many countries in the West, including my own, followed the China model, not the South Korean model.
Right. Professor Chung, Korea's COVID-19 strategy relies on the 3 T's, so to speak, the testing, the tracing, and the treating. Among these components, which do you believe is most important in curbing contagion?
Well, among the 3T approach, I think the initial 2 part, which was the test and trace, had a relatively larger role in Korea, I think, because Korea has enabled a large amount of people in the mass screening and also follow-up inspection through this epidemiological investigations. And this efficient tracing was possible because we can use the information from like credit card tracking or using GPS. However, despite such system, the biggest achievement of these K-quarantine, in my opinion, is a unified movement of the toward the disease prevention of the citizen. And the citizens were willing to cooperate with the government policies, and they had a high compliance, and especially when wearing masks and also adapting to the social distancing. And it's true that now we are also having these difficulties, which was remained. However, maybe the problems of nursing facilities or the correction facilities, we have the problems. However, this citizen has been doing really well to adapt to this new change because we did some kind of endurance over this kind of epidemic.
Right. Andrew, apart from the public participation that Professor Chung has mentioned, what else do you believe was the driving force behind the success of Korea's strategy against COVID-19?
Yeah, no, I gave this a bit of thought because I knew that my colleague here would give a much more detailed response on the actual medical practice. I would say the reason for this very, very effective response goes back to 2014 and the Sewol disaster. Which was the beginning of the end for the Park ChunU presidency, which of course imploded in 2016 and early 2017. And the Korean public made extremely clear they would not support a leader who doesn't prioritize public health and safety. So I think when the Moon Jae-in administration came in, they learned this lesson very well and prioritized that. So we saw very early, there was a massive wildfire in Gangwon province. I think, if I recall correctly, just 1 citizen died in that. It was very well managed. And so I think overall, this idea that health and safety of your citizens is the foremost priority for your government was a lesson well learned by this administration, and that, I think, was the driving force behind the very, very smart, effective and professional strategies which were successfully employed.
Right. Meanwhile, Korea has been actively working to share its strategy with its counterparts across the world. And as part of such efforts, it helped open a COVID-19 testing center in the Democratic Republic of the Congo last November. For more, I have Park ChunU at the United Nations Development Program Office in Congo live on the line. Welcome to the program, Mr. Park.
Thank you very much.
Right, Mr. Park, do start by telling us more about the joint project there.
Yeah. Okay, let me start by sharing brief situation COVID-19 in DRC. Since the first case confirmed on March 10, 2020, early last year, there has been the first wave that peaked in June and the second wave that peaked in November, which has continued today. So today we have DRC has confirmed around 20,000 positive cases, with around 600 people died due to COVID-19. So given the very weak capacity for response to COVID-19 in the DRC, the situation seemed very serious at the beginning. As the situation aggravated, the president declared a state of emergency, taking different measures such as closing schools, the airport with several lockdown and curfews, etc. The National Committee for COVID-19 response has been making lots of efforts. However, it seemed very hard to see the progress, not only due to the capacity limit, but also to the nature of COVID-19, which has been affecting all of the country, all of the world, including international communities who used to be part of the support for the DRC and marginalizing the most vulnerable countries like DRC. So in this situation, international organizations and donors based in DRC also began to participate in the discussion with the DRC government and for collective response. And the UNDP, as part of the UN system, also responded to cooperate in various fields, including this project. But there were several problems. I would mention just two. The first, the national response team was already overwhelmed at the DRC. I remember one day I was in the government office. There were lots of piles of donated materials equipment piled up outside because there was no more space to put them in the storage. The problem is that those materials equipment donated do not necessarily guarantee the expansion of response capacity because the national response team was already overwhelmed. So after several consultations with the government and specialized partners like WHO, we conclude that we need a new diagnostic center with a newly recruited and trained medical staff. So that's how we started. And the other question was, who can make it done? So that's a big question during in the middle of the last year. So it was almost impossible to find a specialized partner during the global crisis, and no one wanted to take risk, actually, in the DRC. But Korea responded to our call, and I saw that they were managing the situation at the time in South Korea. And there was a professional medical team from Suncheon University Hospital who was willing to support us. So together with strong support from the Korean Embassy and the Korea International Cooperation Agency, KOICA, as one of the donors for this project, the project began in July, providing intensive on-offline trainings, materials, equipment, logistics, and transportation, etc., as a whole package, which was very important for the context of DRC, and the center was launched on November 6, 2020. Yeah.
Oh, I see. Mr. Park, tell us a bit more about the daily operation at the center and perhaps also the local response to its presence there.
Yeah. So at the national level, DRC performs around 400-500 tests per day, of which 100 to 200 tests by the new center. And that is around 20 to 40% national coverage. So during a following up meeting I had with the team yesterday, and the medical staff here in the DRC shared some of the ideas on even further expansion of testing as more and more people are coming to the center. Also, it is very timely to have the center now because we are facing the second wave. Lastly, the center has been designed from the beginning to have the testing capacity, not only for the COVID-19, but also for other epidemics. So I hope it will contribute to the response to other infectious disease in DRC that might come in the future.
Right, and best of luck with that. All right, Mr. Park, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much.
Right, Andrew, what are some of Korea's COVID-19 containment efforts that garnered quite a bit of global attention, do you suppose, apart from, of course, our response to the safety and well-being of the people?
Well, I think, again, looking at this from the point of view of Britain, we're not early adopters of technology, so I think the technological response of the Korean government was really captured. And of course, that response was enabled by the high uptake of personal technology among Korean people, which allowed, as was just mentioned by Professor Chung, this conglomeration of databases. You've got the police database, the immigration database, the credit card database, the public transport database, and this really enables very, very fast and effective contact tracing. The other issue, I think, which probably impressed people, which is not exclusive to Korea, but is more exclusive to East Asia, is the civil obedience of the populace. I don't recall anyone protesting against mandatory mask wearing. I don't remember any major riots or demonstrations against social distancing. The public and the publics in this part of the world have generally accepted the need for what needs to be done in the understanding we're in a crisis, and have done what their government has told them. And that's a rather different outlook to what we've seen in the West.
Right. Professor Chung, what are your suggestions aimed at strengthening our strategy against COVID-19, given the surges we saw earlier on in the third wave?
Well, actually, this third wave is also getting longer duration and higher peak as than we expected at the beginning. And actually, at the beginning, there are some arguments that we should have prepared for more beds for COVID-19 patients and also for the critical care patient too. And along with these problems, I think the fundamental thing we should keep in mind is that we are relying very much high proportion to short-term plans and also very much to human power or maybe the individual efforts and not by just the whole system. And I think maybe we should now discuss about this sustainable quarantine right now, because in the daily government policy, it's easy to raise the quarantine stage to higher ones, such as 2.5 or 3. However, we did not make the social agreement when to stop or degrade. So I think now we should prepare more about the long-term plans and for the balanced social, economic, and psychosocial impact of this quarantine policy.
Right. Meanwhile, Andrew, there had been talk in the media about Korea's containment efforts having hit their limits, especially when cases surged past 1,000 back in December. What are your thoughts?
Well, yeah, I mean, everyone reported that. One reports the news on the day, but I think one has to praise it again. As I'm being very praiseworthy. This is very unjournalistic, being very pro-Korea on this. This very flexible application of social distancing guidelines, which are raised or lowered as is needed, and the public has very largely gone along with it. So I would disagree with what you just said. I think it's very clear from your earlier report 15 minutes ago that today we're down to the 300-400 level of infections, which in a country of 51 million people, I think has been very, very well handled.
What about concerns over contact tracing? There were privacy concerns there earlier on. What are your thoughts on that?
Well, there still are privacy concerns. And I think one of if we're talking about the long-term effect of COVID, one job which is going to evaporate at the end of this is the job of the professional criminal. What chance has a criminal got in the future when you've got this extraordinary contact tracing technology which you cannot disinvent? So, I mean, I'm joking, but yeah, I mean, for a Westerner, that is very much an issue. We don't like to share our data. If I had my English business card, for example, I wouldn't have my cell phone number on it. That's not common practice. Here in Korea, it's a different social attitude. So I think, frankly, if it works here, do it here.
Right. Professor Chung, despite the decline, authorities have voiced concerns of the presence of variables. What, in your opinion, is perhaps the greatest risk?
So the great risk, maybe. I think Well, this third wave is actually, well, like Andrew said, it's about 400 new cases daily, but I think it's not enough slowing. So I think we should already been like under like 100 or like 200, but it's like 400 remaining is not enough, I think. And I think this means that there are asymptomatic infections throughout this community which cannot be controlled yet. And so for that, and then this is a cold winter, so people that stay inside, and maybe there are higher chance of transmission when you stay inside, and there are a lot of people inside. And also we have the Lunar New Year, the national big holiday, and this is really a kind of a frustrating situation. And if some people were so tired about this kind of regulation, then maybe they can just violate this regulation and then just gather together and make a higher chance of transmitting virus. So I think the biggest thing we have to worry is the people's fatigue, the psychological fatigue against this physical distancing.
Right. Andrew, Korea's vaccination campaign will kick off next month, fingers crossed, of course.
Yeah.
What is your focus of interest with regard to this upcoming inoculation campaign?
I mean, to be honest, this is not of great international interest, unlike Korea's very early response when Korea was the second country in the world to suffer from COVID. Now Korea is very, very far behind the curve of vaccinations. And I think perhaps it's normal and natural in these situations. If you contain the virus very successfully, perhaps you'd be very late doing the vaccinations. Whereas my country, which didn't contain the virus well at the beginning, are moving very, very quickly on vaccinations. I'll give you an example. The UK is planning, and we're on course to do this, to have 15 million vaccinations by the end of February. Korea is just going to be beginning its vaccinations at the end of February. So the issue here is, regardless of how well or how badly Korea conducts the actual program, I'm confident they'll do a very good job of organizing it. It's very, very late in the day.
And how feasible is the plan of getting 50 million people vaccinated by the end of February, do you
Sorry,
suppose?
1-5, not 5-0.
Okay, right, because I thought 50.
My understanding is, and I'm looking at this from a distance, I cover Korea, I don't cover the UK. It looks feasible. They're moving pretty fast, and thank God.
Right, we'll keep our fingers crossed, of course, right?
Sure.
Professor Chung, Korea is aiming for herd immunity by November at the earliest. In the meantime, what should be done to ensure public safety?
Well, actually, everybody says that vaccine is not a panacea, so the social distance should be done together while initiating these vaccine programs. And also, as I said always, it's important to adhere the quarantine measures, such as wearing masks or washing hands or do the physical distancing. And for the last thing, maybe keep staying positive and keep your daily routine, like making the regular exercise and making the regular sleep, to build the power of endurance until the end of this pandemic.
What are your thoughts on extending the 2.5 current social distancing measures up until after the Lunar New Year?
Well, personally, I won't agree to that, because I think there are too many psychological distress, or maybe the other point of the social economic sacrifices would have been made. So I think this overall people's agreement should be made first.
Right. We have Professor Chung, Andrew, talking about people's participation in the government social distancing measures here in the country. What are your thoughts personally, as a foreign journalist covering that, about Koreans, that is, response to the government's social distancing guidelines?
Well, I think we've already covered this, but I would completely agree with what Professor Chung just said. There has to be social consensus. Thus far there has been, but we're a year into this thing. People are getting fed up. Small business owners are facing annihilation. I go to a gym. The gym has been closed off and on throughout this whole thing. Restaurant owners, bar owners, cafe owners. This is not an existential threat to humanity. This is an extremely undeadly disease. The government has to balance between the good of the economy and the good of public health. And frankly, I think with this very flexible application of social distancing guidelines, the government's kind of making the right decisions. But I would say on the side of non-caution. Let's take a risk and let's be prepared to let the economy and society come back. And if the worst comes to the worst, then we go to level 2.5 or level 2.75 or even level 3.
Right. Meanwhile, Professor Chung, what would you say is the ideal environment for vaccination as we wait for it to happen next month?
Well, ideal for vaccination means that you said herd immunity, so everybody should get vaccinated. Well, I know there will be some caveats between getting the vaccines or not, and people are worrying about side effects. However, we are know by the science that this will make everyone safe. So I think waiting for their turn, and there has a priority, like the people who are in the medical staffs, they get the first vaccinated, and then for some vulnerable people, and then like the other ones. So maybe waiting for their turns quietly and getting involved in vaccination is the best way.
I see. All right, Professor Chung, as always, thank you very much for your insights. And Andrew, thank you very much for your contribution.
Thank you.
Right, a crucial factor, as Professor Chung and Andrew have pointed out, behind the success of Korea's COVID-19 strategy was and continues to be public participation. So do have a safe weekend. I'll be back tomorrow. I'll be back on Monday, that is, with more pandemic coverage.